This is something called Raman Spectroscopy, which is, traditionally what we do is we take a tumor out, we send it to pathology, and they do something called a frozen section analysis. Frozen section analysis takes about 20 minutes. They freeze your tissue, they run an H&E stain, and they look at it under a microscope. And then the pathologist has to interpret it and send it back to you. And a lot of times it kind of dictates what you're going to do, right? If something's a lymphoma, you're not operating anymore because it's so responsive to treatment. All right. And it's invasive in normal brain. It's not a bulky tumor. So you just leave it. You stop your surgery. If it's a low-grade glioma, you might just, resect it aside and then decide not to do something. If it's a high-grade glioma, you may go for a gross total. You may do a supramarginal resection. And not only that, sometimes with the low-grade, as you get to those margins, I should say low-grade gliomas don't really fluoresce so well. So you really need your monitoring. You need your connectomics. You need your navigation. You need everything. And I personally think you need this because as you get to that margin, if you're not sure if it's brain or tumor, you put it in this machine. And what this machine does is it uses a laser, a Raman spectroscopy, and it's able to create a virtual H&E image. If anyone's ever seen an H&E image, it looks just like this, all right? This is created in 2 minutes in the operating room with you, all right? And not only that, advances in machine learning, they've looked at, basically thousands of these images at this point from different tumor types. And it's not FDA approved yet, but it's coming. We trialed it here. We're bringing it in soon. And I was on the first paper out of, I think it was out of Michigan when it came out. The guy's now at NYU. But the computer will tell you, it'll say 90% meningioma, 80% GBM. It's a ratio, it's a proportion, basically. It's telling you, I'm at 90% sure this is a GBM. So within 2 minutes, you get an accurate diagnosis in the operating room rather than waiting 20 minutes outside or 30 minutes, all right? Or if there's something unclear, even longer. So, this is another area where we've really pushed the envelope. Pathologists, I think, are a little bit scared of it, but it's okay.
Hey everyone, Ryan Rad here from Neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.